Hey YouTube, I want to make a video today talking about post-op depression. So I know that in the past couple of weeks I have maybe seemed a little bit out of sorts, definitely a little bit lower energy. I think I even mentioned in one of my videos kind of maybe second guessing my decision kind of as a result of the pain or whatever. And I think that now that I've moved beyond sort of that initial everything hurts kind of phase, it's more of now just a things aren't normal kind of phase. And so it's not depression in kind of, I think, the typical way you would think of depression, and having kind of gone through it before myself, it's a different kind of feeling where this seems more like, I don't know, like a lack of normalcy or sort of a feeling of helplessness rather than kind of a despondency or despair about my life and where it's going and things like that. Because I know if I take kind of that rational step back, I know that this is still very much a temporary kind of phase that I will eventually get out of. From most accounts I've heard, probably 5 months from now, because it takes about 6 months, it seems, for people to kind of get back to normal. But in the meantime, there are sort of things that you take for granted, like sitting, that I still can't really do comfortably, or peeing, because as the tissue around my urethra heals, it kind of can shoot the urine stream off in all sorts of different directions. Sometimes down, sometimes straight out, sometimes anywhere in between. It's kind of like a sprinkler right now. And then you have other things that maybe I was expecting, I kind of knew were going to come. So, for example, necrosis is basically tissue dying, and I knew that part of my labia would be susceptible to that because after the surgery, like, it was at the bottom of the graft, it didn't get enough blood flow, so it died, and now it kind of just falls off, whatever, just like losing a scab or sort of shedding skin or whatever. But now my labia is asymmetrical. I lost a little bit of it there at the bottom, and the doctor's office can certainly fix that for me if it doesn't heal and look better in 6 months. And that's kind of what their response was that like, things are going to change a lot while you heal. Necrosis is typical, like, it's expected, or not uncommon rather, and it's part of the healing process, and we can fix that if it's still asymmetrical after the fact. But I think what part of what makes it more difficult to deal with is the fact that kind of after surgery, I was told I had great results, above average, whatever, and then you literally see those results kind of deteriorate in front of your eyes, and that's kind of unpleasant. There's nothing you can do about it. And it's just like, well, shit. There it goes. She can probably make it look just fine, whatever, anyway, but then that's extra time off of work. Even if her surgeon fee is waived, so I have to pay for hospital anesthesia or whatever. If you need to go fully under and not local, I don't know the details really. It's an inconvenience at best. Which, I suppose there could have been much more major inconveniences, but still, like, it's not something you want. And then similarly, like, during dilation, whatever, like, some skin comes out, that's perfectly normal, but a rather large chunk came out, which suggests that that tissue will probably end up granulating, because right now it's very bright red, scab, scar, whatever, as it heals. And we'll see what happens to that. Can't really say just yet, but from what I understand, that tissue will granulate, and they'll have to take a silver nitrate stick, which I understand to be somewhat of an unpleasant experience, to kind of remove that tissue and make everything nice and smooth and whatever. So, I mean, if these are the extent of the complications, I think that's probably not the worst thing in the world, but, I think no complications, whatever would have been better. Not necessarily realistic when you're thinking about 80% of people, ending up with some granulation. I don't know what the rate is for necrosis. I do know that the doctor doesn't release a kind of data on outcomes, which is also unfortunate, so it's very much a kind of, well, these things are possible, whatever, and you just kind of go through it. And so I see my therapist here in a little bit more than a week, and I'll have my follow-up with Dr. McGinn at the very beginning of March, and that'll be my 3-month follow-up, and we'll see what has changed in between now and then, and wait and see what happens when I get to that 6-month mark. And so I don't know if I will do the revision this year or next year. Probably want to do it. Well, it doesn't matter because insurance won't cover it anyway, so it won't apply against my deductible out-of-pocket maximums and things like that. So doesn't matter if I do it in the same year as breast augmentation or not, apparently. But that'll be a couple $1,000, I think, to do that. So whatever. I guess I should be happy that insurance paid for SRS, and I'll be able to take some of that money that I thought I could use for other things and apply it to a revision. So yay. Not feeling super great right now. I know that I should be feeling a little bit better, but yeah, this is the truth.